here with Neil Caesar, president of the Health Law Center, a healthcare law firm in South Carolina.
That's right.
All right, Neil, I'm a provider, and I'm near a hospital, but I never seem to get referrals for any of the discharges from the hospitals. What do I do?
This is a problem I'm seeing a lot, and I've seen it for years, and it tends to go in cycles. But right now, these days, there's a lot of hospitals that are really steering their patients to one or two companies. Sometimes they're doing it in a way that's compliant with the law, but a lot of times they're not playing fair with the suppliers.
They have to play fair by law, right?
They have to play fair by law. Even if they have their own company, they have to play fair by law. Patient freedom of choice is still required, even if it's their own company that they own lock, stock, and barrel. And in that case, it's required as part of their hospital requirements for participation. It's also there as part of the fraud and abuse analysis. And choice means choice. I think a lot of times the hospitals who want to be able to have a lot of patients go to a certain place don't realize that you don't have to be a big fat hog in order to be able to get your point across. If a hospital says, we have a company that we own, or even just we have a company that we utilize, you can go there, or you can go here, or any place else of your choice, most of the patients are going to say, I don't care, I'll go with your company. And that's fine. The choice should be clearly scripted out. It should be in writing. There's a lot of opportunity for suppliers out there to become these preferred people. A lot of times, most of the time in my experience, the hospital doesn't even want money out of the thing. They just want access, they want assurance, they want quality, they want the ability to avoid being stuck with patients in beds solely because they can't get placed out there. And so a preferred provider relationship between a supplier and a hospital can get the lion's share of the business in a way that's safe if choice is there. Now, I've seen a lot of kinds of abuses out there. Sometimes I see the hospital getting paid something from the company who's getting most of the referrals. Sometimes it's just actual payment, which is clearly a kickback. Sometimes it's a little bit more subtle, like paying for some kind of service in the hospital or space or something in the hospital that's not necessarily needed. It's not necessarily a separate supplier location as far as the NSC is concerned, but it's kind of makeshift money for the hospital. Other times it gets more subtle, where, let's say, a rep from the supplier who's getting all the business helps out the discharge planners with some of their duties. In effect, then the government says, well, you know, they're getting paid under the PPS system for the hospital for doing that work, and you're doing some of the work for free, so we're essentially paying them for work they're not doing, and you're giving them something of value, and that's a kickback. Other times I see it where there's somebody in the hospital who's a respiratory therapist or working for discharge planning who moonlights for another supplier. And during her time at the hospital, she'll go to the patient rooms, people being discharged, and sell them on her company. That's also a no-no, which again, she's wearing her therapist hat or discharge planner hat, case manager hat, while at the same time soliciting patients. All those kinds of things can be fought. For people who just want to be able to get a fair shake, a lot of times bringing these problems to the attention of the hospital or the compliance people at the hospital can shake the tree enough to get things looked at, and anything that's a little bit suspect, more often than not, gets addressed, because usually they don't want the hassle of it all. Especially when, as I said, if you do it right, you can get most of the business and comply with the law.
So in terms of, I mean, the first step a provider needs to take if they see this type of situation is maybe the hospital doesn't know about maybe there's a lack of knowledge.
And a lot of times it's not necessarily official hospital policy. It's just the discharge planner, people having favorites, or they're getting helped out in some way. A lot of time I've had a lot of hospitals out there who prefer just moving to a rotation system. Or if it's going to be based on something other than strict rotation, there's a quality assessment that's part of it. But anytime you poke around, quite frequently, unfortunately, you're going to find some kind of favoritism tied to some kind of benefit. Reduced workload, payment, rent, captive company that the hospital wants to steer all the patients to. You know, it's sad. You'd think with the ability to steer people just by giving them choice and letting them know about the options, you wouldn't find people who are going to deny choice. But I've had plenty of clients call me over the years and currently where they say, I have a long-standing patient who went into the hospital and said, I want to go back to the hospital, and the hospital said, no, you have to use our company. And just Mickey Mouse stuff, and the kind of things that the Inspector General considers the low-hanging fruit, very easy to pick off the tree. And that's the kind of thing that can get hospitals and the suppliers in a lot of trouble very easily.
I've heard a few things here and there about hospitals that do have their own HME kind of washing their hands of it for whatever reasons. I mean,
well, it's hard to make a profit doing this stuff, especially if you're an HME whose patient base is essentially people getting discharged from the hospital. That's not a big population. Most of the time, the hospital-based HMEs that are going to be a success have an active presence in the community and really compete with everybody else, not simply for the hospital work, but for everything. A lot of hospitals that went into joint ventures over the years found that the hassle factor outweighed the profit factor, and quite often got out of it. What they most want is to be able to be assured that the patients are going to have good quality, fast service, accessibility, and turnaround. And that's a perfect opportunity for a forward-thinking supplier making a pitch for being the preferred provider for the hospital, guaranteeing access in exchange for getting their name at the top of that list.
Right. So if that is true, I mean, it makes it even more important for the provider to make sure they have an appropriate or even a relationship with the hospital.
And this is one of those cases where complying with the law not only doesn't hurt you, but you can use it as a marketing tool. Disclosure becomes a marketing tool. We have this company. We use them because we like them. You can use this company or anybody else. That's an endorsement that also happens to be a disclosure requirement.
That's a good point. Great, Neil. Thanks.